Welcome to Infection Prevention and Control in Dentistry module. I am Dr. Ariza and I will take you through Unit 1, Topic 4. In this unit, you will learn on the basis of infection prevention and control, focusing on standard precaution. The specific learning outcomes are as follows. Explain the background of standard precautions. State the rationale for the implementation of standard precautions in dentistry. Discuss the elements of standard precautions. And understand the duties and obligations of oral healthcare practitioners. Universal precautions were introduced by the Centers for Disease Control in 1985, mostly in response to the human immunodeficiency virus. In 1987, the practice of universal precautions was adjusted by a set of rules known as body substance isolation. The term universal precautions refers to the concept that all blood and body fluids should be treated as infectious because patients with blood-borne infections can be asymptomatic or unaware that they are infected. In 1996, the CDC expanded the concept and changed the term to standard precautions, which integrated and expanded the elements of universal precautions to include contact with all body fluids except sweat, regardless of whether blood is present. In 2003, the CDC issued its guidelines for dentistry, which were a more tailored version of the standard precautions applicable to the dental setting. These practices are designed to both protect dental healthcare practitioners and prevent dental healthcare practitioners from spreading infections among patients. Risk control in dentistry is dependent on a single-tier approach in which all patients are treated without discrimination as though they were potentially infectious. Standard precautions applies to all patients regardless of their diagnosis. It is applicable to blood, including dried blood, secretions and excretions excluding sweats, non-intact skin, and mucous membranes. Standard precautions are the minimum infection prevention practices that apply to all patient care regardless of suspected or confirmed infection status of the patient in any setting where healthcare is delivered. Standard precautions are procedure-specific and not patient-specific. Why is standard precaution important in dentistry? Both patients and oral healthcare practitioners can be exposed to pathogens during dental procedures. The occurrence of contact with blood, oral and respiratory secretions and contaminated equipment does take place. There are proper procedures which can prevent the transmission of infections among patients and oral healthcare practitioners in the form of standard precaution. Elements of standard precaution consist of hand hygiene, use of personal protective equipment, respiratory hygiene or cough etiquette, shot safety, which include engineering and work practice controls, safe injection practices, i.e. aseptic technique for parenteral medications, sterile instruments and devices, and clean and disinfected environmental surfaces. Hand hygiene is defined as any action of hygienic hand antisepsis in order to reduce transient microbial flora. Hand hygiene is generally performed either by hand rubbing with an alcohol-based formulation or hand washing with plain or antimicrobial soap and water. The rationale of hand hygiene include many infectious agents are acquired via hand contact with contaminated surfaces. Hand hygiene is effective in reducing microorganisms on the skin. Hand hygiene is the most important measure to avoid the transmission of microorganisms and prevent healthcare-associated infections. There are two types of hands microflora. These are called resident flora and transient flora. Let's look at the resident flora. Resident flora are inhabiting organisms of the skin. They form a factor in ecologic and microbiologic balance. The primary organisms include Coagulus negative Staphylococcus, Corynebacterium species, and Klebsiella species. They are not easily removed through hand hygiene. On the other hand, the transient flora are regarded as contaminating flora or hitchhike organisms. They are usually acquired by direct contact and the most common mode of transmission for healthcare-associated infections. The common organisms include Staphylococcus aureus, Streptococcus species, and Pseudomonas species. The transient flora are easily removed via hand hygiene. The types of hand hygiene are hand washing, hand disinfection, and surgical scrub. Hand washing involves the use of soap and water. It is done over 40 to 60 seconds, and the main purpose is to remove dirt, body fluids, and transient microorganisms. Hand disinfection involves alcohol-based hand rub. The action is performed between 20 to 30 seconds, and it is able to kill and remove transient microbes and reduction of resident flora. Surgical scrub involves the use of aqueous antimicrobial disinfectant. The action is over 2 minutes, and it is able to kill and remove transient microorganisms with substantial reduction of resident microflora. Alcohol-based hand rub has optimal antimicrobial spectrum activity and the most rapid bactericidal action. It is more convenient than using the aqueous solution. Alcohol hand rub can increase compliance in hand hygiene. However, alcohol-based hand rub is a complement to and not a replacement for hand washing. You are advised to refer to the link given on the proper technique on how to use alcohol-based hand rub and how to do a proper hand washing. Indications of hand hygiene in the dental setting include when the hands are visibly soiled, before and after treating each patient, after touching with bare hands anything that is likely to be contaminated by blood, saliva, or respiratory secretions, and before putting on gloves and after removing gloves. Next, we move on to personal and protective equipment. Personal protective equipment, or PPE, refers to wearable equipment that is designed to protect healthcare workers from exposure to or contact with infectious agents. The selection of the type of PPE is appropriate for various types of patient interactions and effectively covers personal clothing and skin likely to be soiled with body fluids, secretion, and excretion. It is important to know what type of PPE is necessary for the duties you perform and to use it correctly. The appropriate selection of PPE for adherence to standard precaution involves the use of gloves in situations involving possible contact with blood or body fluids, mucous membranes, or non-intact skin. The use of protective clothing to protect skin and clothing during procedures or activities where contact with blood or body fluids is anticipated. And the use of mouth, nose, and eye protection during procedures that are likely to generate splashes or sprays of blood or other body fluids. Next PPE is gloves. Gloves can be made from vinyl or latex or nitrile, and the use of glove is either for sterile or non-sterile procedures. The principle on the proper use of gloves are: work from clean to dirty, limit the opportunities for touch contamination, protect yourself, others, and the environment. Change gloves when necessary, and discard them in appropriate waste disposal. Remember, gloves are for single use. Wear gloves for all routine dental treatments and perform hand hygiene after removing gloves. The three types of glove commonly used in the clinical setting are made from natural rubber latex, nitrile, or vinyl. The three types share similar properties, which include: they are impermeable to blood-borne viruses, they provide close fitting, they do not impair dexterity, and they are not prone to splitting. They are also resistant to water-based chemicals. In addition, the nitrile glove is also resistant to solvents and oil-based chemicals. Amongst the three types, the nitrile glove has the lowest failure rate under stress conditions. Allergy has been reported with the use of natural rubber latex or nitrile gloves. One can use the vinyl if they are allergic to nitrile or natural rubber latex. Next is apron or gown. Apron or gown can either be from the cotton or spun synthetic. They are resistant to fluid penetration. They can be clean or in the sterile form. The indications for use of apron or gown are as follows. Plastic aprons should be worn when there is a risk of exposure to blood, body fluids, secretions, and excretions. Full body gowns need only be used when there is the possibility or extensive splashing of blood, body fluids, secretions, or excretions, and should be fluid repellent. In contact precautions to prevent the transmission of multi-drug resistant organisms, wearing both gown and gloves prior to room entry, regardless of the anticipated level of contact, may reduce the unanticipated contact with the MDRO in the environment. Make sure you choose the right type of apron or gown. Protect yourself from splatter with a disposable plastic apron. If extensive exposure to blood or body fluids is expected, then fluid repellent disposable gowns would be appropriate. The face protection include masks, goggles, and face shields. The mask is further divided into surgical mask or particulate respirator for example, N95 mask. The protections are as follows. Masks protect the nose and mouth. It should fully cover the nose and mouth and prevent fluid penetration. The goggles protect the eyes. It should fit snugly over and around the eyes. An anti-fog feature would improve clarity. A word of caution, personal glasses are not a substitute for goggles. Face shields protect the face, nose, mouth, and the eyes. It should cover the forehead, extend to below the chin, and wrap around the side of the face. Let's look at the protection of the respiratory tract in dentistry based on the source of particles. If the source of particles is via splashing or spraying, the route of transmission would be in direct contact with mucous membranes, eyes, nose, mouth, or the skin of the face. The recommended protection would be eye protection together with surgical masks. If the source of particles is droplets, the route of transmission would be via inhalation, which penetrate the respiratory tract to above the alveolar level. The recommended protection would be the use of eye protection and surgical mask. If the source of particles involves aerosols, for example, from any aerosol generating procedures, the route of transmission is via inhalation, which penetrates the respiratory system to the alveolar level. The recommended protection would be the use of eye protection and respirator masks. Prevention of the transmission of tuberculosis in dental settings. Although the transmission of tuberculosis in dental practice is rare, it still poses a risk. It is important to note on the following aspects. Defer the case as elective dental treatment. If the patient must be treated, observe the following. The oral healthcare practitioner should wear face mask or face shield. Separate the patient from others. Control the aerosols by high volume suction. Ideally, refer to the facility with proper TB infection control measures. And perform the procedure in a well-ventilated room which has 12 to 15 air changes per hour. The next element of standard precaution is respiratory hygiene or cough etiquette. Respiratory hygiene or cough etiquette infection prevention measures are designed to limit the transmission of respiratory pathogens spread by droplet or airborne routes. The strategies target primarily patients and individuals accompanying patients to the dental setting who might have undiagnosed transmissible respiratory infections, but also apply to anyone with signs of illness including cough, congestion, runny nose, or increased production of respiratory secretions. These posters show the cough etiquette that one should follow when coughing and sneezing. Needle stick and shots safety. Oral healthcare practitioners should be aware of the risk of injury whenever shots are exposed. When using or working around sharp devices, oral healthcare practitioners should take precautions while using shots, during cleanup, and during disposal. A sharp injury refers to any injury or puncture to the skin involving a sharp instrument such as a dental burr, syringe needle, or suture needle. The implementation of the OSHA blood-borne pathogen standard has helped to protect healthcare workers from blood exposure and SHOPS injuries. However, SHOPS injuries continue to occur and pose the risk of blood-borne pathogen transmission to healthcare workers and patients. The transmission of blood-borne pathogens of importance are hepatitis B, hepatitis C, and HIV. Engineering and work practice controls are the primary methods in the prevention of needle stick and SHOPS injury. These include safe handling of SHOPS, whereby SHOPS-safe dental treatment practices should be adhered to. Use of safety SHOPS, for example, the use of safety needles with integrated retractable sheath, and using freestanding needle guards and resheathing blocks. SHOP-safe disposal. Placed, use disposable syringes and needles, scalpel, blades, and other sharp items in appropriate puncture-resistant containers, preferably located as close as possible to the area where the items are used. Safe injection practices are intended to prevent transmission of infectious diseases between one patient and another, or between a patient and oral healthcare practitioners during preparation and administration of parenteral medications. Safe injection practices are a set of measures oral healthcare practitioners should follow to perform injections in the safest possible manner for the protection of patients. Some of the unsafe practices that have led to patient harm include the use of a single syringe with or without the same needle to administer medication to multiple patients. Reinsertion of a used syringe with or without the same needle into a medication vial or solution container, for example, a saline bag, to obtain additional medication for a single patient, and then using the same vial or solution container for subsequent patients. Preparation of medications in close proximity to contaminated supplies or equipment. Follow the good rule of safe injection practices as advocated by the one and only campaign by CDC and the Safe Injection Practices Coalition. Remember, one needle, one syringe, and only one time. The next important element of standard precaution is sterilization and disinfection of patient care items and devices. Decontamination should be considered as the application of a range of appropriate processes that will render an item safe for use during dental procedures. In general, dental instruments and equipment are classified based on the potential risk for infection associated with their intended use, which can be categorized as critical items, semi-critical items, and non-critical items. Critical items are those used to penetrate soft tissue or bone. Semi-critical items are those that come in contact with mucous membranes or non-intact skin. And non-critical items are those that come in contact with intact skin. Let's go through some of the patient care items and devices based on the three categories: the risk of transmission of infection and the method of decontamination. Under the critical category, this has the highest risk of transmission of infection The examples of items are surgical instruments and periodontal scalers, and the method of decontamination is via sterilization by heat. Semi-critical items examples include mouth mirrors, amalgam condensers, reusable dental impression trays, have a low risk of transmission of infection, and decontamination is via heat sterilization or using high-level disinfectant. The non-critical items, for example, radiograph head, blood pressure cuff, and face bowl, have the least risk of transmission of infection, and decontamination via normal cleaning or using protective barrier would be adequate. The Spalding decision tree can be used to determine the decontamination of dental instruments and equipment. This is based on the Spalding classification that the items can be categorized under non-critical, semi-critical, and critical, which have been alluded earlier. Factors which determine the decontamination method include whether the items can be easily or difficult to clean, whether they are chemical or heat resistant, and whether they can be reprocessed. The last element of standard precaution is environmental infection control. Contaminated environment plays an important role in the spread of microorganisms, and if not thoroughly cleaned and or disinfected on a regular basis, it may act as a reservoir for potential pathogens. Pay attention to clinical contact surfaces. These include housekeeping surfaces and cloth finishings, spills of blood and body substances, and regulated medical waste. Emphasis for cleaning and disinfection should be placed on surfaces that are most likely to become contaminated with pathogens, including clinical contact surfaces in the patient care area. When these surfaces are touched, microorganisms can be transferred to other surfaces, instruments, or to the nose, mouth, or eyes of oral healthcare practitioners or patients. As a rule, hand-touched surfaces must be thoroughly cleaned and disinfected more frequently than surfaces that have minimal contact with hands. This picture illustrates the various frequently touched surfaces in the patient care area in a dental setting. Standard precaution can be viewed as a part of the duties and obligations of oral healthcare practitioners. The duties and obligations of oral healthcare practitioners are clearly stated as follows. Oral healthcare practitioners who perform clinical work have a duty to keep themselves informed and updated on the codes of professional conduct and other guidelines laid down by the Dental Council. Oral healthcare practitioners have an ethical and legal obligation to protect the health and safety of their patients, their co-workers, and themselves, and if they are employees, to cooperate with their employer in such matters. Oral healthcare practitioners have an ethical obligation to know the infection status with reference to HIV, hepatitis B virus, and hepatitis C virus. Oral healthcare practitioners who have had an exposure incident or who believe that they might have been exposed to a blood-borne virus by other means must, without delay, seek and follow expert advice on whether they should be tested for blood-borne virus infection. Thank you, and I hope you have benefited from this module.